Hi, my name is Chris Sterling and I'm with Siksika Community Health. I'm a community health nurse there. And this is another video in our series regarding COVID-19. In this video, we're going to discuss what you can do to protect yourself from COVID-19 and what precautions you should take if you were to get sick with COVID-19. So there's 4 ways that you can protect yourself from COVID-19. The first one and most important one is maintain or constantly do your hand washing. Make sure you're hand washing on a regular basis, effectively. In the next video, we're going to discuss and do a tutorial on proper hand washing, but for the sake of this video, hand washing is number 1. Okay. Number 2, you want to try to maintain social distance of 2 meters from any other person, particularly when you're out in public or at work. But if someone is sick in your home, this is another good precaution with the individual who is sick as well. So this is that social distancing thing you've been hearing about quite a bit, or part of it anyway. And we'll have another video about social distancing and what it entails. But maintain and practice social distancing, that would be the number 2 thing that you could do. Number 3 is just to try to avoid touching your nose, eyes, or mouth, particularly if you haven't washed any hands, because these are your infection points. If the droplets get into one of these spots or the virus gets into one of these spots, that's how you're going to get sick. So try to be aware of what you're doing or what makes you touch your face throughout the day. If you've got glasses and you're constantly rubbing underneath your eyes, or maybe you have hair that you're constantly brushing out, or there's some form of something else in your face that make you touch your face. If you're someone who, like myself, bites on pens all the time, you want to be aware of those and try and resist and stop doing those things as much as possible. Because each time you touch your face, that's going to be a potential contagion point if the virus is on your fingers at that time. And the last thing you can do is just make sure you're sanitizing all common areas that people would be touching, because those are areas where it's most likely the virus might be waiting to get onto your fingers. So that would be things like door handles, like keyboard mice or computer keyboards and mice, cell phones, toilet handles, sink, faucets, whatever's kind of in and around your house or your workplace. And a good way to kind of be aware of those things is throughout the course of the day, keep track of the things that you're touching and think, maybe, do other people touch this on a regular basis? If that's the case, that would be an area you would want to sanitize. So at work, other things like the coffee maker, the water cooler, those types of things would be high touch areas as well. Okay. So the 4 things: hand washing, maintaining social distance, which includes that 2 meters, and making sure you're not having close personal contact with anybody who is sick. Making sure that you don't touch your face, so avoiding touching your eyes, nose, and mouth. And finally, making sure you're sanitizing common touch areas. Now, in case you, unfortunately, are one of those individuals who get sick over the course of this pandemic with COVID-19, there are some things you can do to help protect other people from getting sick. And the number 1 thing, again, is hand washing. Because if you are sick, this is probably the most likely way that you'll spread the virus. Your hands are contaminated, you touch common touched areas, other people touch it, then they touch their eyes, nose, and mouth, then they can get sick, okay? The other way to do it is you want to try to avoid having your droplets spreading everywhere. So if you're coughing or sneezing, try to talk into your arm, or cough into your arm. And finally, stay home. If you're sick, don't go out in public, don't go to work. And this goes for any respiratory symptoms, whether they're a runny nose, stuffy nose, sore throat, cough, fever, difficulty breathing, all that kind of stuff. You want to stay home. Well, if you're difficulty breathing, you want to go to the hospital. But for everything else, you want to stay home. Treat any respiratory illness as COVID-19 until the outbreak is over. Okay? And you probably want to stay home for at least 14 days unless you're tested for COVID-19 and are positive. And then you receive tests that say that you're negative. After that point, you'd be okay to go back to work. Otherwise, stay home for at least 14 days, even if you're feeling well for a while after that. At this point, please don't go to the hospital or go to your doctor's office. If you're having symptoms of COVID-19, go online, fill out the self-assessment tool at www.ahs.ca/COVID. That tool will guide you as to whether or not you need to get tested, and they'll give you instructions as to how to do that. Now that might change over the course of these months as this epidemic expands or progresses. But at this period of time, that's what you want to do. If you have symptoms, do the self-assessment tool, call 811 if you're directed to, and get testing. The only way you would want to be going to the hospital, just in case, is if you're having severe breathing or severe difficulty breathing. You want to go to the hospital or call 911. You may need hospital support, and we don't want to waste any time in that regard. Okay? So now you know what to do to protect yourself and what to do in case you get sick. Hand washing, social distancing, sanitizing common areas, and avoiding touching your eyes, nose, and mouth are the 4 things you can do to protect yourself. So in the next video, we'll do a hand washing video just so everybody has a really good idea of how to do it properly, and we'll see you there. Thanks.